Hello, everyone. Welcome to our Zoom meeting. Today, we're going to have different topics. So Dr. Naud and his team will be presenting today. So I'm going to hand it over to you when you are ready. Here's the agenda for today's meeting. Hello, everyone. Welcome to our Zoom meeting. Today, we're going to have Dr. Naud, when you are ready, and your team, please go ahead.
Okay. Is Dr. Mistre Beyene available?
Yes, I am.
Okay. Hi, everyone. I hope everyone is having a wonderful morning or evening, depending on your time zone. So as always, today's meeting, we will have 5 topics to present. The first topic is going to be about telehealth in older adults. And the second topic is going to be about how to build an app. And third topic is going to be about the research. And the fourth topic is going to be about analyzing a research paper. And the last topic is going to be organizational skills. So as always, the first presenter will start presenting. And if you have any question, you can wait until the presentation is done, or you can unmute yourself at the end of the presentation and ask a question, or you can even chat or write your questions at the chat box. So with no further ado, I hand over to the first presenter, Dr. Mistre Beyene, and she's going to present about telehealth in older adults. Thank you.
Thank you. Is everyone able to see the slides? And can hear me?
Yeah, we can hear you. And
We
the
can hear
slides
you, but
are...
the volume would be nice if you do that.
Okay, so today we are going to see telehealth in older adults. I am Dr. Mistre. These are the topic we are going to cover. We are going to see the definition, introduction, and different telehealth modalities, the asynchronous, synchronous, remote patient monitoring. And
sorry to interrupt, Dr. Mistre. Can you put the volume up? I don't think everybody's hearing you clearly.
How about now?
Much better. Thank you.
Okay, you're welcome. So today we are going to see telehealth with me. These are the topics we are going to see. We're going to see the definition, introduction. We're going to go through the telemodalities, the asynchronous, synchronous, and we will see a remote patient monitoring. And finally, we will cover reimbursement, ethical and legal considerations for geriatric telehealth. Coming to the definition, telehealth is the use of information and communication technology to deliver health care at distance or from remote. When we see the coverage of telehealth among older adults, it has lagged on a national sample done on 15 to 18 years old older adults on 2019. It showed that only 4% had a real-time telehealth visit. These telehealth modalities has shown to be feasible and acceptable to older adults in variety of settings, but there are some barriers. For example, internet access, device ownership, and digital literacy and device accessibility are some of the barriers. When we come to the modalities of telehealth, we have the asynchronous, the synchronous, and the remote patient monitoring. When we say asynchronous, we mean there is no real-time connection or communication between patients and the physician. These are some of the examples: secure messaging through patient portal, secure messaging between clinicians, and electronic consult, also sometimes called e-consult. When we say synchronous telehealth, we mean that there is real-time interaction between patient and clinician. These are some of the examples we are going to see: clinician to clinicians, and video encounter and telephone encounter. The third one is remote patient monitoring. When we say remote patient monitoring, we from remote data collection. For example, this data can be the blood pressure of the patient, the glucose, or fall detection system. So we can monitor these data from remote, and we can give feedback intervention, especially in managing chronic diseases. The other one is we can use telehealth for education purpose among clinicians using real-time interaction. One of the model we can use is Scan Echo remote education program. Coming to the asynchronous telehealth in some of the example, we have already mentioned, I have already mentioned the secure messaging between patient and clinicians. It's also called patient portal. So this has been found to have positive impact in patient satisfaction, retention, ease of access, and communication. When we use this patient portal, we need to train older adults, both with low and high health literacy. And also we need to train not only the older adults, we need to train the caregivers too. The other one is after they enrolled, especially the older adults with higher health literacy, have found this to be useful. The second example under asynchronous telehealth is secure messaging among professionals. So this has been found to be a core quality indicator, especially for home-based primary and palliative care. It has helped in providing timely communication about complex patient and more cohesive care planning, especially, for example, when used in senior living. It has shown to give fewer emergency department visits for ambulatory cares, because these ambulatory cares can be managed using this secure messaging. The third one under asynchronous telehealth is electronic consultation or e-consult. We are going to see this in different perspective, in primary care physician perspective, in patient perspective, and specialty perspective. When we see this in the primary care perspective, it allowed fast specialty input, but the drawback is it put too much pressure, too much work on the primary physician. On the patient perspective, it has helped the patient with fast access to care, and the patient, they don't need to travel, but the drawback is the patient are unable to discuss the treatment plan or ask the specialist a question. On a specialist perspective, it's helped the specialists to give a brief input, but the drawback is regarding compensation for all the time spent may not be adequate, and the specialists may give some complex care plans, which might be difficult for the primary clinicians to implement. We are done with asynchronous telehealth. Coming to the synchronous telehealth or the real-time communication, we have clinician to clinicians. These are some of the examples we can use to do this synchronous telehealth. For example, the Scan Echo stands for Special Care Access Network extension for community health outcome. What we do during Scan Echo is the primary care clinician or the rural provider will present case using teleconference or video, and the specialist will give some recommendations. The other model we can use is Echo Care Transition. In Echo Care Transition, we use this especially when the patient is transitioning, for example, from hospital to a skilled nursing facility. So the professionals can exchange information, and this has led to reduce lengthy stay in hospital, and decreased hospitalization, and also reduced cost. This eco model has been studied not only in older ages, and it has shown to improve and provide competence and patient outcome. The other model we can use under clinician to clinician is virtual geriatrics. This was formerly known as geriatric care conference. So what is done here is the urban geriatric center is going to act as a hub for consultation for the rural veteran and their primary care clinicians. So this virtual geriatrics use synchronous and also the asynchronous, and also it uses webinars. And it has shown to be promising in improving access of rural veteran to geriatric expertise. Nowadays, social media has been widely used to expand the reach of geriatrics. For example, streaming geriatric rounds have been possible because of the social media. And during COVID-19, many geriatric education programs have been converted to webinars. The second example under synchronous telehealth is telephone encounter. So telephone is more widely available, and you can use it to diagnose and for therapeutic tasks. For example, we can use to assess mental health of the patient. We can use it to give psychotherapy. We can use to do follow-up of patients on psychotherapy medication. And also it has been shown to improve depression symptoms and well-being. We can use this telephone to assess fall risk, promote physical activity and exercise. And we can use this telephone to improve pain and disability, and in older adults and also support smoke cessation. The other thing we can use this telephone is to do a screening for cognitive impairment. When we use this telephone to do screening, we have to be careful selecting which tools are useful for which patient. These are the example of tools we can use to assess or to screen cognitive in older adults, but we must be careful to choose which to which, because some of the modalities might not be compatible to be used in remote area. For example, some of the examples are here already: telephone interview for cognitive status, and all of this. Coming to the other example, video encounter under synchronous telehealth. So video encounter now is rapidly being used, especially after COVID-19, because of the regulatory relaxation came after COVID-19. Before COVID-19, the rules and the regulations were very tight. The benefits of video encounter is that we can do part of physical examination. We can see the patient doing the physical examination. The other one is we can see patients who are unable to come to the clinic. The limitations are technical literacy, and also there are challenges in establishing a rapport. We have to do some things before we set video visits. These are things we should do before we set video visit. For example, we need to verify that patient has high-speed internet, the device with webcam, and we have to make sure that the patient is able to access and operate the video communication program. And regarding the physician, it is advised to use 2 monitors, one for the video visit and the other simultaneously used for accessing patient information. The other one is we have to verify all participant and patient contact information, because we might need it during troubleshooting. For example, if the video is not working, we might call the patient, so we need the patient contact information. The other one is we need to arrange caregiver or interpreter if needed. It can be done either by on site through phone or through video. The other one is we have to make sure that patient and provider should each be in a private and quiet setting. And the other one is when we start the video, we have to verify the patient location and the presence of anyone other than the patient, and also we have to obtain verbal consent. So when we are planning the video, we need to anticipate some challenges and be prepared. For example, if we anticipate hearing impairment challenges, because these are most common in older adults, we need to use headphone, and if possible, we can use closed captions. If we are anticipating visual impairments, we need to use adaptive device programs. For example, use magnifying softwares, or use high contrast background, like for example black and white for any text. And if we are anticipating cognitive impairment, we need to prepare caregiver assistant and use simplified video device programs. The other one is if we are anticipating any connection or any speed, internet speed, it's better to use a landline for audio connection. And if it fails, if for example the video fails, we might need to switch to telephone only. So coming to adapting the geriatric 5M for age-friendly video visit, we are going to see this 5M. The first M is what matters. So when we do the video visit, we need to focus on what really matters for the patient right now. So we can use some assessments to identify what really matter for the patients. For example, we can do advanced care planning assessment or caregiver burden assessment, or observe patient's environment to learn more about patient life. So the first aim is what matters. So these are some of the tools we can use to assess what really matters for the patient. The second one is we can view medications through video, and also we can set up or adjust medication. And these are some of the tools we can use to do that. The other one is we can screen for the patient for example, cognitive screening, delirium screening, mood and mental status. So these are under mentation. So when we do this, we have to be careful, as I already mentioned, on which type of tool we use for which patient, because some of the tools might not be used for some cases. The fourth aim is mobility. We can, through video, we can assess the mobility of patient by ordering the patient to perform chair stand, and we can observe him walking. And the other one is we can observe the environment the patient is living and identify fall hazards, and we can manage that. These are the tools we can use. And the last aim is multi-complexity. As we all know, most older adults has multiple problems. So we need to learn how to prioritize these problems and act accordingly. For conducting a priority assessment based on history and observation will help. And these are some of the tools we can use. Coming to the third modality, remote monitoring. When we say remote monitoring, we monitor, for example, the blood pressure or the glucose or the fall risk from distance. So this has been used in a large scale with veteran on chronic disease on older adults, and it has shown that fewer hospital admission and less time was spent in the hospital in the prior year. So it has been useful, but generally there are limited evidences considering the outcome. For example, when used in hypertension, COPD, and rehabilitation, there is limited outcome. And when we see on older adults using chemotherapy, it has shown to improve the quality of life and fewer ER emergency room admission, because these older adults were able to report their symptom electronically between visits. So when we see factors that affect the utility of remote patient monitoring, it include clinician engagement, integration of data into the medical record, clear workflow, and timeliness. Coming to the reimbursement policy and implication for geriatric telehealth, it has shown that there was payment parity between real-time telehealth and in-person service. So the physicians, because there is parity of payment previously, physician prefers the in-person because it pays more. This was true in the private insurance and also in Medicaid. But the good thing is after COVID-19, this has been changing, and now the rules and the regulations has been more relaxed regarding reimbursement and payments. So when we see the Center for Medicare and Medicare Service adapts and creates long-term adjustment after COVID-19, will have enormous impact on continued availability of telehealth for to older adults. So now the Medicaid coverage has increased for telehealth, so it's a positive input. Coming to the legal consideration for geriatric telehealth, there are some legal consideration we should see. For example, privacy and HIPAA. Regarding privacy and HIPAA, it's the same like the in-person. We need to be compliant to HIPAA, and also we need to secure the privacy of the patient and also the privacy on the physician side. And also we need to take informed consent. Regarding the licensure has been increasing. It has been given for many clinicians. For example, in 2019, the 2017 interstate medical licensure compact was introduced, and it allowed eligible physician to apply for licensure in multiple states. And also on 2018, physician working with the veterinary affair were able to practice across state lines, and there was temporary waivers for 47 states to use out-of-state physicians and some others healthcare providers to practice in their state over the telehealth. So when we see the licensure, now it is getting relaxed, and more physicians are able to use telehealth. Regarding controlled substance prescription, these controlled substance prescriptions are governed by the federal and the state. So when we see the federal Rain-Hate Act, it says that the patient has to be in a brick and mortar. That means the patient has to be in a clinician office or in the hospital or in the clinic when doing the telehealth visit in order for them to get these prescriptions. The other one is a clinician has to be familiar with each state and regulations because they are different regarding controlled substance prescription. And the DEA requires the clinicians to obtain separate DEA registration. The exception is if they are working in the VA or in the veterinary affairs. And also there was exception in the COVID-19 where the physicians were able to order controlled substance without DEA registration. Regarding the supervision of training, the Accreditation Council for Graduate Medical Education has allowed both residents and fellows to participate, to use this telehealth tool to supervise. So it's been allowed, but the supervising clinicians has to ensure that this trainee have adequate training to deliver effective telehealth for patients with sensory or cognitive impairment. And during COVID-19, the teaching clinicians has been using audio, video, and real-time communication. And one thing the teaching physician has to be aware is there are liable. They are held liable for care they directed and supervised remotely. Regarding the issue liability and malpractice, the liability is the same like in-person care. So clinicians, they have to make sure that their insurance, their malpractice insurance policy covers the telehealth because the liability is the same. And the other one is the liability regarding physical examination. These physical examination are prone for misdiagnosis because they are unreliable. The other ethical concern is uncertainty when in-person meeting is necessary, and there is also uncertainty in physical examination, and also there is uncertainty about effectiveness of the communication via remote modality, and also regarding the informed consent, it reflects limited evidence regarding benefit and harm of telehealth in older adults. When we see the equitability access to telehealth, 10% of adults in US are offline. These are because of older age, less education, low income, Black and Latin ethnicity, rural residency, and disability. So telehealth requires appropriate device, and it also requires comfort with this device and with the technology, and also especially these older adults need support sometimes. When we see the estimate, 1 of 3 of adults 65 and above years old were unable for video visits in 2018. In the same year, 2 of 3 adults 85 and above years were unready for video visit, and 20% of adults 65 and above have difficulty with telephone encounter. So how do we enhance the use of telehealth in older adults? Basically, we help these older adults, we assist them. For example, we help them in having internet access. We can introduce them with the discount data plans given by the federal law. We can help them enroll in these data plans. We can assist them in digital literacy by informing them and helping them enroll in a digital literacy lesson given in the local public library or in the community-based program. The other one is we can help them in device accessibility. For example, we can inform them where these devices are being given. For example, the smartphones, the tablets, and also we can help them with the software accessibility, especially for those with vision and hearing impairments. Tools such as personal amplification device, magnifying device can be used, and we can tell them, we can teach them, we can help them and teach them how to use those softwares. If needed, we might refer them for audiology, vision, occupational therapy, and speech therapy. The other one is during the video visit, it's better to use simple, user-friendly platforms. And if the older adult is uncomfortable at all, we need to have support present by their side. So that's presentation. Now you're gonna see the summary. We have seen changes, how COVID-19 brought on telehealth utilization, how the rules regarding reimbursement and the use of telehealth was tight, but after COVID-19, it has improved and now it is more relaxed. And we have seen the telehealth modalities, the synchronous, and the remote patient monitoring. And we have seen some modification has to be done when we encounter patients with hearing, vision, cognitive, and limited access or comfort with technology. And we have seen clinicians need to have good judgment in deciding whether in-person or telehealth will benefit the patient. The other one is clinicians should use the geriatric tools with caution, and they should be careful in interpreting these tools because Some of them may not be validated for remote administration. We have 3 cases. The first case is a 75-year-old woman routinely comes to the office every 6 months for follow-up and renewal of prescription. She is due for the next visit. History include hypertension, hyperlipidemia. She lives independently and has no significant mobility or cognitive issue. She is running low on her medication but hesitates to visit the office during the COVID-19 pandemic because of potential exposure to the virus. So the question is, which of the following is the best alternative to an office visit for this patient? You can answer through the chat. Okay. Okay, that's correct. You said D, so we can use synchronous televideo or telephone visit. The second one is a nurse practitioner requests a geriatric consultation. She would like to reduce the medication burden for 80-year-old man with depression, osteoarthritis, and heart failure. He currently takes 12 prescribed medications and 3 supplements. He lives 90 minutes away from the closest consulting geriatric office. He does not have internet access in his rural community. The nurse practitioner is his primary care provider. The question is, which of the following would be most appropriate in this situation? So we have the asynchronous geriatric electronic consult, e-consult. We have in-person comprehensive geriatric assessment. We have remote patient monitoring and the synchronous. So many of you have said in person, be in person. For me, I would say this is asynchronous because the patient is 90 minutes far and he doesn't have internet access. So we can do asynchronous geriatric. If anyone has different idea, you can reflect at the end of the presentation. The other one is a 92-year-old man contacts the office. He reports a painful itchy rash on one side of his chest. His description of the rash suggests possible herpes zoster infection. He lives independently in senior housing that is locked down because of COVID-19 pandemic. There is no nursing care in the building. Residents may not leave unless there is medical emergency. The question is, which of the following is the most important consideration in advising this patient? So most of you said D, so we need to advise the patient in everything. We need to advise him in all of the above. That will be the end of the presentation. I would give back to Dr. Naud. Thank you.
Thank you, Dr. Mistre. I think she did a great job in precisely and concisely explaining what telehealth is and how we can be a beneficiary of this concept in treating patient. The one thing that keep on coming as a concept or as a thing during telehealth usage was COVID. During COVID time, because you don't have a direct access to the patient and the patient does not have a direct access to the provider, this telehealth usage has been appreciated more during the COVID time. And there was already other form of telehealth usage, such as virtual care centers, virtual sitters, all ECG monitoring, such as telemetry, which was already in place before COVID, but it was appreciated also more during COVID. The only problem with the telehealth usage, especially during COVID, was you can't do physical examination, but it was very helpful, especially in like depression and mood disorder during COVID, where you basically depend on the patient's narrative or history rather than the physical examination. So that was also appreciated during the COVID. On the patient side, not everyone is aware or knowledgeable enough to use a telephone, internet, Zoom, or Skype. So that was the only downside of the application of telehealth during COVID. So nowadays there is an advocate for providers to send only one-click link to join the doctor during a telehealth visit, which doesn't involve or which doesn't have a second code verification or put in your password. And I think Dr. Mistre did a good job in explaining other aspects of the telehealth. If anyone have a question, you can chat your question in the chat box, or you can raise your hand and have your question. Thank you.
Thank you so much, Dr. Mistre. This is an excellent presentation and it's an important topic. So even when we talk about telemedicine or telehealth, during the interview season, they change from in-person to tele interviews. So that's another option. In geriatrics, as Dr. Mistre mentioned, there are some limitations. Before COVID, there are some options of getting the patient to a clinic where they can start the teleconsultation, for example, the second question or case number 2. The patient can go to the family doctor office in their city or village or place where they can start the telecommunication or telehealth visit with the consult who's in a different city. This can be done, and that's another option as well. Thank you so much for great presentation.
I think we do have a question from one of the participants about licensure for the telehealth work. I'm not sure about the question. Can you unmute yourself and maybe ask more?
Hi, this is Ella. So thank you for the presentation first. Secondly, is so I worked in a clinic, and in some states they don't allow some doctors to do any telehealth consultation. So they have only license for one state. So is there a special license that covers the other states? Like you take a license for telehealth other than your license to practice medicine in the same state?
So as far as license, it's practiced in the state where you have the license. Let's say I am in Michigan, I have the license from Michigan State, then I will practice medicine in Michigan State. I cannot see a patient in New York State, for example. If I want to do more than that, I can apply for license in other states. Some of the physicians had or they have more than one state license, so they can practice in different places. That's one option.
Thank you very much.
You're welcome. Dr. Ahmed, go ahead, followed by Dr. Lama.
Hello, everybody. Thank you. Really very good presentation. Thank you for enlightening us about this very important issue. And really, one of the advantage of COVID-19 is the use of telemedicine increases, and it is here to stay because the advantages are so many. And it really, even for the patient, sometimes they chose the virtual visit after the initial encounter. And this really makes it very it's safe time for the patient. And also, in a way, it will increase like the timing that the patient needs to visit with the physician, especially the elderly, because sometimes traveling is something difficult. For example, here at our clinic, we see the patient for the first time, and for example, he might lives 1 hour, 2 hours away, and really for the second visit and the third visit, they request the telemedicine, for example, for discussing the result, for discussing the new medications, side effects. And in some situation, if you describe a medication that unfortunately gave rise to side effects, for example, for rash, you could even look. And this type of medicine is really progressing, and really in the 6 months to 1 year, there might be a big difference. And it is always evolving and in progress. So thank you. Thank you, Nadia.
Thank you so much, Dr. Ahmed, for a great comment. And I do agree. It's important tool, and it's like the stethoscope. Many people use it, some don't, surgeon, for example, but it's a very useful tool, telemedicine, and with some limitations.
Just to add a little bit to
Nadia,
that.
sorry.
Go ahead. Okay.
Yes,
Special outpatient OPD patients or outpatient departments, they prefer to be seen through telehealth, especially for the prescription refill or visits which involves only 10 to 15 minutes. Nowadays, they prefer to be seen virtually rather than driving 35 minutes or 40 minutes to visit their primary care provider, which end up in a 10 or 15-minute visit. So as Dr. Ahmed was saying, telehealth is definitely here to stay for a long period of time. Thank you.
Nadir, can I comment?
Yes, please.
Thank you, Nadir. You mentioned this is just another issue brought by the excellent point you mentioned, and telemedicine, and also you mentioned the stethoscope. And this is another new thing, and it might have been discussed, or this topic might have been presented previously, is the ultrasound. Point of care ultrasound also is here to stay, and I hope one day or in the very in the coming sessions, there will be a topic about ultrasound as well. And this is just, by the way, Nadir, you mentioned the stethoscope, so this is the ultrasound, point of care ultrasound, and ultrasound will be is just like a regular tool. We are going to use it on our daily encounters. Thank you.
Excellent. Thanks for sharing this. Yes, point. Great point. Go ahead, Dr. Lama, followed by Dr. Talan.
Hello, everybody. Thank you so much for the nice presentation. I have one comment and one question on this topic. So my comment is working in very rural area at this point in post-acute care. So it's probably about 3 hours drive from Seattle. So this telehealth is very critical in patient care. So in our post-acute care has the referral hospital, but the hospital doesn't have any like interventional cardiology or neurology. When there are patients that can be sent to the hospital with either CVA or stroke, they will usually do a neuro or cardiac teleconsult. And if the patients are candidates for immediate intervention, they will be airlifted to either Seattle or nearby, hospitals. So this is very important. If we're living in an urban area, that it might seem like, better to have patients in person, but this is very important at this point, especially in rural hospitals. But my question is, so when we do, it's not related to the topic directly, but when we apply for residency, some of us, like, there was a trend to put like an experience as a telehealth working back to home country or something. So to fill some gaps, working as a telemedicine physician or something. So we've been doing that for a while. So to fill out some gaps in our clinical experience. So my question is it a good idea to put like telemedicine on our experience part while doing our residency applications or not? Because Dr. Nadir says that every state needs specific license for telemedicine. So I'm just questioning because of that. Thank you so much.
Thank you so much for your comment and your great question. Yeah, I think any experience, US experience, will be valid and will be appreciated by the program. They don't want you to be sitting doing nothing in your application like for a long period of time. Sometimes we have some obligations or some things in life happen. These can be explained during the interview, but in your application, it's better to fill these gaps, even if it's telemedicine-based training. Thank you.
Go ahead, Garanlam.
Garnaim, that's me, or there's someone else?
Go ahead, Dr. Garanim.
Yes, thank you. Thank you, Dr. Nadir. I want to share an experience of telehealth. Like, I was diagnosed with hyperthyroidism a long time ago, and I ended up with total thyroidectomy. So I live in Georgia, in Abt House. So nearby, it was no like endocrinologist to follow up with him. It took me like 1 hour to have an endocrinologist. They gave me that option during the COVID-19 outbreak, and it was helpful because I didn't need to go like to the clinic, and so I saved time, I saved like gas, saving money. So it is really it is very great opportunity to have telehealth when there is some obstacles like affecting your movement, or you can't get it in right time. So that's my experience. I keep continuing after COVID-19, like several appointment with telehealth, and I appreciate it. It saves like time for me, and I get the right treatment on time. If there is any like kind of comment or concern, I can send message and she can reply after 24 hours. It is very helpful experience. So just I want to share my experience that with telehealth sometimes is very good, is very effective, and is saving like time and as I said, money. Thank you so much.
Thank you so much for sharing your personal experience. And yeah, it's very useful Thank you. I do agree.
We do have one question in the chat box about health insurance coverage for telehealth, whether they are cover whether your insurance cover any form of intervention or being seen by doctors through telehealth as they do in Medicare and commercial.
So it depends. During COVID, most of the health insurance and the government permitted telehealth with no limitation. But after 3 years or so, several months ago, then they went to some of the pre-COVID limitations. For example, when I see my patient in nursing homes, the limitation is that I can see them in person for any event or encounter needed, but only once a month virtual visit. If I want to do telemedicine, it's only once per month per patient. So I cannot see them more than that, or I cannot be paid for seeing them more than once a month. This is some of the limitations, but there are other limitations as well. Thank you.
Or if there is no more questions, we'll proceed to the second presentation, which is going to be about how to build an app, and we'll use the INR Guide app as an example, and it will be presented by Dr. Amal and Dr. Mafaz. As we have been doing in this program, even though this is not the primary objective of the program, this is also a good idea to put something in your CV that differentiates you from other applicants during residency season. You will have something in your CV that not everyone does it. And secondly, for those of you especially who want to pursue medical device specialists or want to do sport medicine, this is also a good way of accounting or maybe familiarizing yourself with different apps. So Dr. Amal and Dr. Mafaz will take the floor and will proceed with their presentation.
Thank you very much, Dr. Naoud, and thank you very much, Dr. Mistre, for the great presentation. I'm going to share my screen now.
Give me a second, Dr. Amal.
Okay, yeah, sure.
Try again, please. Thank you.
Thank you very much. So are you able to see my screen?
Yes.
Okay, great. Just I'm trying to hide the control panel on the top of the screen. Okay. So hello, everyone. Thank you very much for coming along. My name is Dr. Amal, and today I'm going to be presenting a topic that I am very passionate about, which is how to develop a mobile application. And by the end of this presentation, we are hopefully going to build an application for patients with congestive heart failure. And throughout the process of building this application, we are going to learn the basic components of the app development platform that I'm going to be using. And just I want to indicate that this presentation is based on my personal experience. So please feel free to ask any question or share any thoughts that you think is important. So the objectives by the end of this presentation is to learn how to make a plan and how to identify tasks that you are going to distribute to your team members. Also, how to make a team. And the fourth objective is how to navigate through the app development platform. I'm going to use Codular because I am familiar with this platform. Also, the fifth objective is how to use YouTube and app development app development platforms, or I mean app development solving problems. And the sixth objective is using the companion app for real-time testing. And also the last objective is how does artificial intelligence helps throughout the process. So the first objective is how to make a plan. Of course, making a good plan is a very important step for any project that you are planning to start, whether this project is a mobile application or it is a research project. Making a good plan is a key to success. So my approach of making a plan for the app development is, for example, first of all, I'm going to use my previous clinical experience. So in this case, for the sake of this presentation, I'm going to pretend that I have no previous experience. I'm a first-time app developer. So I want to develop an application for patients with heart failure. So the first thing I'm going to review is my previous clinical experience. So for me, I have worked with patients with heart failure when I was an intern, and these patients, I know that these patients have problems with adherence to medications, have problems with getting access to the hospital. And so by identifying these problems and identifying the solutions for them, I can implement some ideas into my application. So the second thing that I'm going to review when I want to make a plan for my project is reviewing different mobile app stores. The two most famous mobile app stores are the Play Store and the App Store. So for me now, I'm going to show you how I search into the Play Store when I want to make an application. Okay, so here I just get into the Play Store and I write like keywords, like for example, heart failure. And as you can see, there are many applications designed for heart failure. And some of these applications are directed to healthcare providers and some of them for patients. So I'm going to be reviewing the applications that are specifically made for patients and not for healthcare providers, because the objective of my application is to help patients. So I can see that this application is built for patients and not for healthcare providers. First of all, I'm going to go to the About the Application section and read carefully what they have written here, because this will give you an indication of what their intention was. Was it built for the patient or for the healthcare provider? So by reading the first sentence, like cardiovascular disease management and tracking, Meet CardioHealth, the cardiovascular health app that helps you manage. So I understand that this is usually for patients. So now I'm going to install the application and look to the features that they have added. So it will give me a general idea of what these applications should contain. I'm not going to copy paste the exact idea into my application, but at least this will help me build a good plan. So the other option, if you don't want to install the app, is to review the screenshots that they have added when they uploaded the application to the Play Store. So by reviewing the pictures, I can see that they included a blood pressure log for the systolic and diastolic. And this is, of course, a very important measure to monitor in patients with congestive heart failure. They have also included medications that these patients take, which is also very important. So now I'm trying to gather some ideas that I'll be adding into my application. Also, they added like healthy diet options. So now I just got some ideas from this application. So the same way, I'm going to go back and review other applications as well. And using the same approach, I'm just trying to collect some ideas to make a good plan. So the third step is, of course, I'm going to be asking my mentors for help. And this is a very important step because, of course, your mentors are more experienced than you. They have seen many patients, so they can help you identify the gaps in app development and what are the important features that if you include it in your application, it will be very helpful. So the last thing is using artificial intelligence for making the plan. And I'm going to use ChatGPT as an example. So here I have asked ChatGPT to suggest different components of a mobile health application designed for heart failure patients to help them adhere to their medications and manage their illness more effectively. So it suggested about 11 ideas. So it suggested things like adding a medication reminder, medication tracker, prescription refills, education and information, symptom tracking. So I'm going to read all these suggestions carefully and just to assess if it's applicable, if I want these features to be included in my application. And of course, this is a personal choice. It depends on your initial thoughts and your initial objective. Okay, so after gathering all these ideas, I have asked my mentors and I have used artificial intelligence. I asked my seniors. Now I have an idea in mind and I know what my application should contain. So there are two options. I'm more like a visual person. I like to draw my plans on papers or drawing them on Microsoft Paint app. Here I have used Microsoft Paint app to draw my plan. So for this application, for heart failure patients, I added 3 main pages. So the first page is the splash screen, which is the screen that appears when you first open any application. For example, when you are using Facebook or YouTube, when you open that application, the first screen that appears with the logo added on it, and then it appears for 5 to 6 seconds and then disappear. This is called the splash screen. And it's one of the most important components in any application. So this is the screen that I want my application to have. I draw like a very simple drawing of the icon in the middle and the name of the application. I'm going to be calling it Heart Wellness. Okay, and then I have the home page that contains the main buttons that are going to transfer the user to the other pages of the application. And here my profile page that contains the measures and important information that each patient is going to enter while using my app. So after I have made a clear plan, now I know what my application contains. The second step is to identify tasks. So someone might ask me, you have not like made a team yet. So this is my approach. I usually don't start by making a team. I start by making a plan as a leader and by identifying the tasks that I'm going to be distributing to my team members. Because if I made a team and added team members to the WhatsApp group as the initial step, I'm lost at that stage. And all team members are going to ask me, what are the tasks? What are the next steps? So I'm not going to be able to answer these questions. So I like to be prepared in advance. So according to my previous plan, I have identified some tasks. I need a graphic designer because I have an icon. And later on, when I upload the application to the Play Store, I need to design some pictures that are going to be uploaded to the Play Store itself. So it's very important to have a graphic designer. And the second thing I need is I need someone to write something about the application just to describe our app. And this is a very important section actually because it should contain very important keywords. So this will help users identify my application when they search in the Play Store. So it should contain keywords like heart failure, monitoring, medication adherence, and so on. So the third task is going to be gathering pieces of information for the healthcare guide. Of course, I need some educational information for the patients. So this is going to be task number 3. Task number 4 is to put things together. So I need someone who's familiar with the platform, who can put things together and bring the application to life. And the 5th task is writing the disclaimer section. And the 6th one is advertising for the application via multiple or different social media platforms, like LinkedIn, X, Twitter previously, or Facebook. So it's important to note that multiple team members can share one task. So I can have more than one graphic designer, more than one member to write about the application section. And of course, pieces of info needs like multiple team members because there are going to be many information I want to include into my application. Also, the technical part of it can be more than one member. So I just want to highlight the point that you can include as many members as you can in your application. So finally, we are coming to the point of building a team. So how can we build a team? Where do we recruit these team members from? So we usually use the main Telegeriatric Research Fellowship WhatsApp group. You just open the WhatsApp group and send a message saying like, good morning, I have an idea of building an application for patients with heart failure. Who's interested? And usually you are going to find a great response from all members, because all team members are interested in like learning new skills and trying something new. So this is how you recruit, as simple as that. So there's another way, which is adding members with a certain set of skills. You might know someone who's very good at designing images, for example. So you want to add that member. You might know someone who can put things together and use the platform itself. So you want to add that member. So this will help streamline the process of building and makes it more time efficient. So there are general tips that I wanted to share. The first one is please do not target members with certain skills only, because at the end of the day, we all have the ability to learn new skills, and we all interested in learning new skills and how to develop mobile application that will help patients. So you can include anyone who's interested. And it's always a good idea to involve as many members as you can. Also, start off with a small number and then increase gradually. So this is what I do. It's not a good idea to include, for example, 30 members or 20 members from the beginning. At that point, you are usually lost, especially if it's your first time and you don't know which tasks are going to be assigned to all these 30 members. So it's good to start with like 10 members. And then as you proceed with the app development, new tasks will appear. You will likely need help with other features of the application. So start off with a small number and then increase gradually throughout the process. So of course, after making your team, you have developed that plan by yourself. So at this point, of course, you want to discuss your plan with your mentors and team members and ask for feedback, because this is a teamwork and everyone's point of view is very important in the process. So the fourth thing is navigating through the app development platform. So at this point, I'm going to exit the PowerPoint presentation and you are going to start the real work on the Codular platform. So how to access the Codular platform? You just type in Codular Creator, as you see here, and then click on the first link. Then click on Create Application. So if you are a first-time user, they are going to ask you to log in using either your Google account or make an account using your email and password. So it's a good idea to use your Google account because it's easier. So then you are going to click on Create Application. For me, because we have developed like multiple applications previously, that's why this appears on my screen representing multiple projects that we worked on. But if you are a first-time user, you are not going to have these boxes. You will have only these on the top, which says to create a project. Like it means to start a new project from the scratch, or importing a project, which is a project that someone has started previously and you want to continue on that. So I'm going to click on Create Project. So I'm going to call it Heart Wellness. Yes, you cannot like add a space. It should be a dash or something. And then click on Next. So here it will ask you to include like or modify different settings for your application. My app name is Heart Wellness. Theme, I will leave it like default. And minimum SDK level is the level that by which like your phone operates. So leave it as such. I don't advise you to change anything, because if you change anything, it might not be uploaded to the Play Store later on. So package name will be assigned automatically, so don't write anything in this box. And you can change the colors if you want, but I will leave it as such. And then click on Finish. So now this screen will open up when you write the application name and change all the settings. So here you have the option to change your application name that you first entered. And as you can see, this platform is divided into two interfaces. There is the designer interface and there is the block interface. The designer interface contains so many components. As you can see on the left side of the screen, there are different components that you can pull up and put into your screen. And this designer interface is the interface that is going to appear to the user when the user is using your application. But the blocks interface is things that happen behind the screen. So the user will not be able to see what you're adding here on this part, but he's able to see everything that you're adding on this mobile screen. So here there are many different components. So now I'm going to start developing the app. And while I'm doing so, we are going to learn the basic components of this platform. So according to my plan, let's get back to my plan. So I want to develop the splash screen, or start off with the splash screen. So how can I develop that? So as a first-time user, I don't know how to develop a splash screen. So this is how YouTube and app developer communities can help you. So here, if you don't know any idea about how to make this, you can either, of course, ask your senior and they will usually help you, or you can go to YouTube and type in just a question, how to make a splash screen in Codular. As simple as that. So you will find many videos that will help you throughout the process. And some also included features like an animation and very beautiful screens. So this is a good way of using YouTube to help you. So now I'm going to show you how to make a splash screen in a very simple way. So for me, I want my screen to be blank. I don't want these control panels or this option menu and the status bar on the top of the screen. So how can I hide that? is just by going to the right side of the screen and check all these boxes. And as you can see, it disappeared already. So now I want to include an image into the middle of the screen, because here I wanted to add an image and the name of my application. So here I'm going to search by typing in image. I'll put the image here. So there is a problem here. I don't want the image to be on the upper left part of the screen. I want it to be on the middle. So what can I do is by clicking on the screen, for each component you click in, the properties of that component are going to appear on this bar. So instead of left, here the screen orientation is on the left. I'm going to click on this and click the center. So as you can see, it becomes centralized. So I don't want the image to be up here. I want it to be on the middle of the screen, so I can add a space. The space is a very important component that will help you change positions of every component that you are adding. And I want to increase the height of that space so this image can be displaced in the middle. So instead of automatic, I will add something like 10%. So you'll keep on increasing until you reach the location that you want. So I can add something like 40%. Now, yes, this is what I want. I want to be on this part of the screen. So now I want to add the image. How can I add the image? The icon that I want for my application is by clicking on the image itself and then click on this. I chose none. So how to upload images to the platform? It's by clicking on this picture icon and then click on upload asset. It will show you different images that you have on your computer. So I will choose an image that I previously added, which is this one. And then it says, a notification says that the image has been uploaded. So I'll close this screen, click on the image again, and choose the logo. So the image has been added to my screen. I just want to decrease this to 30%. How to add the name of my application on the bottom of the screen? So to add any text on the screen is just by adding the component called label. So on this label, I'm going to write the name of the application, which is Heart Wellness. And of course, I can control different features of the text. So I can make it bold. I can increase the font size. Instead of 14, I can make it something like 19. And I can change the text color. Instead of black, I want to make it maybe like blue. And if I don't like the white background of the splash screen, I want to make something like yellowish. So I can click on the screen and the properties of that screen appears here. So I can, about the screen background color, okay. I mean the background color here is white. I can change it from here and I can control whether I want it like a dark shadow or a light shadow. I want it a light one, so I can just pull this up and put it here so I can get the shade that I want. So this is just the designer interface. So how I check that everything I put onto my screen is in place. So the screen that you are seeing here is not going to reflect the reality. So you have to connect your phone with the companion application so you can see the real application on your phone. So it's called a test. So how to make a test? By clicking on test and then clicking on connect the companion. But before that, the companion, let me tell you just a little bit about the companion. So the companion is an application that help you like make a real-time testing of the application that you are making. So here you can download it from the Play Store by typing in Modular Companion. And yes, this is the companion application. And after installing the application, you are going to click on scan the QR code, which is what I'm going to do now. So it will take some time to connect to the computer. So this is how the application looks on my phone, or the screen looks on my phone. So now I can see that the icon is not as big as it appears on the platform. Here it appears big, but here in reality it's small. So I want to control the size, and I want to check, for example, to control the colors. I don't like the colors. And so this is the general idea of the companion application, is to have the real-time testing. So here also you can add like a circular progress, just to like add a design to the screen. And this is how it looks. Okay, so now I want this screen to disappear after 5 seconds. How can I make that? So this is how we come to the blocks section. I'm going to add the clock component. The clock is going to work behind the screen. The user is not going to be able to see the clock that I added. It's going to count for 5 seconds, and then the screen is going to close automatically, and it's going to lead me to the second screen. So because it's going to lead me to the second screen, of course, I need to have a second screen. How can I make a second screen? By clicking on Add Screen. The second screen is going to be the home page. So I already created the home page. Now I want to get back to the splash screen that I already designed. So you can navigate between screens by clicking on this drop-down menu. And I'm going to choose screen 1. So I added the timer component. Here, when I click on the clock, it's going to show me the properties of that clock. So here you can control the time interval. So 1000 means 1 second. So I don't want my screen to disappear after only 1 second. I wanted something like 5 seconds. So I want to type 5000. And always uncheck this box which says timer always fires, because this will always like when you open the screen will get you back to the splash screen again and again. So I don't want this to happen. So uncheck this always. And then let's go to the blocks section. So I want to tell them when the user opens the screen, ask the clock to start counting the 5 seconds. And when these 5 seconds are up, ask the application to transfer me to the home page screen. So just like I said that it's written here, it's like self-explanatory, not that complicated. So how can I do it? By clicking on the screen here. So I will choose an order because I said that when the user opens the screen. So I will choose when screen 1 initializes. And I will pull up this here. And after that, I will go to the clock. And I will choose set clock 1 timer enabled. Yes. Timer enabled to true. On the logic section, it says true. This is the way how you said like a translation of what I have said. When the user opens the screen, when it initializes, ask the clock to start counting. So now I want to ask the clock, after the time is up, please transfer me to the second screen. So by going to the clock, here when clock.timer, it means when the time is up. So I want to duplicate this. Here you can duplicate instead of going back and forth from here to here. It's easier to just duplicate this action. So when the time is up, I will ask the clock to start counting, or else it will stop counting, or else it will start counting from the beginning. So I will change this to false. And then I want to add an order to open another screen. From the control here, you can find many orders and you choose this one, open another screen. You just put this here, and I'm going to choose the home page. So now I want to test everything I have done and whether it works or doesn't work. So it's a very good idea to test each time you make a progress because you don't want any mistakes. So I want to test again. Okay, so this screen should disappear after approximately 5 seconds. Yes, so now it works. So this is how to build a splash screen, and this will automatically lead me to the home page. So for the home page, according to my plan, I want to design up to 5 buttons here. So how can I make buttons, which is a very important and basic feature of each application. So as I told you previously, if you want to hide this option menu and status bar, you just go and uncheck these boxes. And always make sure to centralize the screen, because by default, the screen is directed to the left. So make it central. And of course, I like to add a space and make it something like 4%. Of course, you can control the design according to your plan. So the first button I want to add will lead me to the About the Application section. And then I want to add a space and then another button and then a space and continue like this. So instead of pulling up a space each time, I'm just going to duplicate and drag this here. And I can duplicate the button, but I don't like that because it becomes confusing sometimes. So I like to pull up a new button each time. So I'm going to add up to 5. So here, how you can change the text of the button. You can change the text of the button from here. As I told you, each component you click on, the properties of that component are going to appear on the right side of the screen. So for button 1, it says about the application. So I'm going to type in about the app. And for the second button, it says my profile. So I'll write my profile. And for the third one, health guide info or information. So, and I'll continue the same way. You just change the text from here. So for the sake of time, I might not add all of them. Okay, so now you can control the properties of these buttons, but I advise you also to name the button from here, because the names you add here are going to appear on the blocks section. but the names you change from here are the names that are going to be visible to the user. So why do I want to change the names here also? Because here they are given a default name like button 1, button 2. Because if you don't change them, then when you go to the blocks section, it will appear like button 1, button 2, and you will not be able to like figure out what button 1 was, what its function, and what its purpose. So it's always good to change the name from here. For example, about the application, give it the same name. Like button 1, you can just add about the app and click on rename. And my profile as well. Click on my profile. And also health guide information. You type in health guide for short. And now I have renamed all the buttons. So after that, I want to give these buttons a function. Like when the user click on the button, I want that the action is to transfer the user to that page indicated by the button. So of course, I need to have 3 pages as well. A page for about the app, page for my profile, and page for the health guide info. So I will add the screens here. And create. And we'll add another screen as well. I will add the 3rd screen. So now I want to get back to the home page. So how can I make a function or design that button like when the user click on it, it will transfer them to the indicated page. So this is very straightforward. So I will ask first of all, I will go to the blocks section and then identify the first button. This is why I renamed all the buttons, so you can see that I'm easily identifying it. It's the button for about the application page. I'm going to click on that. And like find an order that asks when the button click do. Like it's very self-explanatory. When the patient is going to click on that, do something. So what's that something going to be? It's going to be to open another page. So how do we pull up an order for opening a new page? It's from control section. So here, open another page. The page name or the screen name is going to be about the application. So likewise, I'm going to program the other buttons to do the same. So as I told you, you can always duplicate. You don't have to pull up each time. So the second button is going to be my profile. As simple as that, you're just going to change. And I'm going to duplicate also for the 3rd one. It's going to be the health guide information. So that's it. And I have ordered or designed these buttons to transfer the user to another page whenever the user clicks on them. So let's try this. So this is the companion application, and I'm going to click on the button. As you can see, it transfers me to the page that I want. So here on about the application page, I'm going to add a text describing my application. Of course, one of my team members provided me with that text. So I'm going to type in that text or just copy paste. So if you are going to copy paste, you cannot use this like a right click on your mouse and just click on paste. This is not available in the application. So you have to press on Control V instead. So Control C is for copying and Control V is for pasting. But now we don't have an available text, so I'm just going to type in I'm going to show you how I can add a text here. So by pulling up a label and then typing like this app is designed for congestive heart failure patients to help them have like anything you want to type. Of course, this is a simple text. Of course, you want to add a full description of the application. Here you can always see what you have done. I don't want, for example, the text to be on the top of the screen. I want to add a space and I want to change the color. So everything you can do is available here. So I want to add a space here, and the height of that space is going to be something like 5%. And then I want to change the font and make it bold. Maybe I'll make something like 17 and change the color from black. Maybe I want a green color. So this is how you can control the design of the text that you add on the application. So now I want to go to my profile page. So on my profile page, you are going to add different like entry fields that we think is very important for each patient to have. So for example, you want to add the name of the patient. So the name of the patient is not going to be a label. It's going to be a text or a text box. Where can you find the text box? You can search for it, or it's easier to just search. So this is the text box I'm going to be adding here. This is for the name, and I will be adding a space as well, maybe like 5% space. So I'll duplicate that space so I can have a good design for my profile page. So I can pull up another text box or I want to add the date of birth. So the date of birth is going to be added using the date picker item. I'm going to put that here. I want also to add a field for weight maybe, or for systolic blood pressure. So this is for systolic and another one for diastolic. And I want to add a list for the medications the patient is taking. So I'll be adding something called list picker here. So how does the patient know that this field is for name, entry, and this one, for example, is for systolic blood pressure? So you have two ways of identifying these fields. The first way is by adding a label on top of that field. And calling this label, for example, name. And the second way is by changing the hint. If you don't want to include the text here above, you can just change the hint here and call it, for example, name. Let's see what we have done so far in the companion. So here, this is the first way is to add the name above the text box, and the second way is by adding a hint. And the hint is going to disappear when the patient types his name. So this is another way of identifying the field. So here I'll be adding a hint as well, systolic blood pressure. And this is for diastolic blood pressure. Okay. So now what I do in the blocks section to make this functional. So I go to the blocks section, and here it doesn't need any like type of programming or changing the function, because the patient is just going to enter their name. But for the date picker to be functional, it should be changed from here. So I will add when screen initialize, which is my profile. No, sorry, I'm not going to add this one. So I'm just going to describe what I'm going to do. So this is the time or the date picker. When the user clicks on this date picker, they are going to choose their date of birth. Now I clicked on it. So I want when the user chooses their date of birth to be saved in the application, so they don't have to re-enter each time they access the application. So how can I do that? So I'll go to the date itself. I'll choose after date set. So what I want like to have after I set the date, I want this text to change and to show me the actual date of birth for that patient. So I'll go here on the date picker and choose an order of set date picker text. So I want to set it to the date of birth of that patient. So I'm going to choose a text here. And if you want to join multiple texts together, you choose the join block from the text bar here. So now I'm going to make them as 5 spaces instead of 2. So first of all, I want the month to appear, and then the day of that month, and then the year of the date of birth of that patient. How can I do that? I will come back to the date section or the date picker here. I'm going to choose date picker dot month. And then here I want the day to appear in the middle. And then I want the year to be visible. So let's test that. When I click on this, I'm just going to put it as the date today. So as you can see, it has changed, but there are no like any dashes or something to separate the days from the months from the years. So how can I do that? So in the empty text box or the empty fields that I have added here, it's just by adding a slash like this. And everything now is going to be changed. Let's reset again. So this is the date of birth of that patient. So now let's try all fields. So the patient is going to enter their names, systolic blood pressure like 120/80, for example. And then how to add the medication list to the list picker. So here I'm going to choose when screen initialize. So it means that when the user opens the screen, I want you to add the medication on the list. So how can I add the list? So here I'm going to go to the list picker from the left side of the screen. And type in here items. Like I want to choose the items. Or elements. So the elements, you are not going to be able to add it while using the join block. It's better to add it while using the lists. It will not accept the join block. So here we are going to choose make a list. So of course, patients with heart failure use multiple medications. Here I can add just 3 of the most commonly used medications. So how to add the medication name? I'm going to pull up a text string and duplicate that one. So I want to add 3 medications. Of course, when you are designing the application, you are going to add much more medications than 3. So I'm going to add, like, let's say they are taking a diuretic. They're taking an ACE inhibitor like lisinopril, maybe a beta blocker as well. So this is how I add items to the list. So if you want to create a list for any purpose, this is how you make the elements of that list. So I want to go back to the companion application to test what I have done and to see if these items have appeared on the application or not. So I will click on the list. So because the lists, I have not changed the color of the list itself is black and the color of the items are black, and that's why it did not appear, but they are actually here. So let me change the colors. So when you click on the list here, it shows the properties of that list. You can change always the background. I'll make it white. And the item text color is going to be something like black. Now let's test what we have done. So when I click on the list, it shows the medications that I already added. As I told you, you can add much more than that. So this is how to add a test to your application. So how can I add like a sharing button to the app? So I'll pull up the sharing functionality and put it here. It's an invisible component, meaning that it will not appear to the user. It will just function behind the screen. And then, of course, I want to add a button so the patients can share their information with a family member, for example. I'll add that button here. And of course, I want to add a space. I will call that button share. So now I'm going to go to the blocks section and click on sharing or click on button 1. I want the user when the application, when the user clicks on button 1 to share the information or the data that they have already entered, like their name, their date of birth, and their systolic and diastolic blood pressure, and of course the medications that they are taking. So how can I program that button to do that? So when button one click, and then I'm going to go to the sharing. Call sharing when share a message, because I usually want to share a message. Then I'm going to choose join, because as I told you, if you want to join multiple things together, you choose the join string from here, and then you add it here. So I want to share whatever written here in this text. So I forgot to rename every component. You should rename it. It makes it easier for you in the blocks section. So text box 1, it's for the name of the patient. So I'm going to be searching for text box for the name. So I want to share the text itself, the text that the patient has written. So I'm going to choose something like text box dot text. Dot text means that you want to share the text. Of course, you don't want to share the text color or the text length. You want to share the text itself. So you are going to put this one here. Also, make sure to separate between the shared components. You can just add an empty space, or you can add a dash, for example, or anything that you use to separate texts. So also for the date of birth, I'm going to be sharing the text for the date of birth. So I'm going to go to the date picker, and just the same way I added the text for the name, I'm going to put here or choose dot text. I'll put that here. And of course, I always want to separate between the components. I also want to share the systolic and diastolic blood pressure. Sorry, the screen is just frozen. Okay. So this is named as text box 2. I'm going to search for text box 2. So instead of like searching for it from here, I can just duplicate as long as they are both texts. So it's text box 2. I want to share the diastolic as well. Which is text box 3. So as simple as that, now you are going to be able to share all the components to the family member or to the healthcare provider. So I want to try the sharing functionality that I just added. So I'm going to type the name, date of birth, systolic blood pressure, diastolic. And I have not added the feature for the drugs, but I'll add it later. So, and then I just wanted to show you how the sharing functionality works. And then by clicking on sharing, it will show you like different. So as you can see, it has shared my name, my date of birth, my systolic and diastolic blood pressure. This is how you create a sharing button. So the last feature, according to my plan, I want to create like I already created my profile page. I was not able to add all components for the sake of time, but don't worry about that because it's all have the same concept. It all has the same idea, so it's not that difficult. So how to add the health information guide page. So here I will click on the health info guide or health guide info. I want to hide all these bars from the top of the screen. And of course, I want to centralize the screen as well. So I will be adding a space. I'll put it here. So I'll add something like 5%. So I want to add, just like I added in the home page, I want to make buttons, and when the patient clicks on that button, it shows the information. But when the patient clicks on the second button, it hides the information of the first button and shows the information that are related to the second button. So how can I do that? So from here, I'll be pulling a button. And I will be adding two healthcare information or pieces of information. So I add a button here also. So my team members have already prepared this information for me. So if I click on the notes, I have just added them on the notes. I want to talk about congestive heart failure. What is congestive heart failure? And what are the different symptoms of congestive heart failure? So here, I'm going to change the text of that button by adding the question on it. What is congestive heart failure? And here, I'm going to type in what are the symptoms of congestive heart failure. So instead of putting the text directly into the screen, I can put it in something called vertical arrangement. So the benefit of a vertical arrangement, it will enable you to hide the information if you want to make it visible, if you want to make it invisible, and you can make it visible at any time according to the design of your project. Let me show you how that works. So here I'm going to type in vertical arrangement. It's basically a screen on top of a screen. So I'll put that here just beneath the what's congestive heart failure question. And I'm going to put another one just beneath the second question. So instead of adding the text on the screen itself, I will be adding my text on the vertical arrangement. So because the vertical arrangement is very narrow, I want to make it wider so it can accommodate the text that I will be adding. So here I will make it something like 95%. I usually make it 95% and make sure to control the width and not the height. The height is better to be automatic so it can increase with the increase in text. So the more you add text, it will automatically expand, but the width should be something like 95%. Here also, I will make it something like 95% also. So inside that arrangement, I will be adding a label. And then I'm going to copy paste the text that my team members provided me. So what is congestive heart failure? So I'm going to copy the first piece of info. So as I told you, you cannot just copy paste by right clicking on your mouse. This will not function. So you just have to click on Control C from your keyboard. And then here press on Control V. and the text was added successfully. And then here, the same concept, I'm going to click on Control Copy. I will just copy the entire text. And then I will add a label, of course. And then here, I'm going to change the text of that label by adding Control V. And this is how I added my text. So I want to hide these vertical arrangements when the patient open the screen. Let me go to the test mode so I can better explain my idea. So this is my text that I have added. So I want when the user first enters this page, I don't want this text to be here. I want it to be hidden. But when the patient clicks on the button, it will show the text by clicking on that button and not automatically. So I want to hide these texts. So I will hide the text by hiding the vertical arrangement itself. And that's why I made that vertical arrangement in the first place. So this is vertical arrangement 1 and this is 2. I'm just going to go to the blocks section and choose when screen initialize. My screen is called the health guide info. So I want when my screen initializes to hide those vertical arrangements. I will just pick any order because I will always be able to change the order from the drop-down menu. So I'll click on the function visible. Visible, it should be false. So I want the vertical arrangement visible to be false when that screen initializes. So I'll go to logic and choose false. Also, I will do the same for the vertical arrangement number 2, which contains the second piece of info. So this is how I'm going to be hiding the vertical arrangements. If I just refreshed here, I just refreshed and I'm going to show you that it was actually hidden. It doesn't appear anymore after putting that function. So how I ask the button to show me the vertical arrangement and the information when the patient clicks on the button. So of course, I'm going to go to the first button, which contains the first question. That is, what is congestive heart failure? So it's button number 1, and I will choose one button click. So here I'm just going to duplicate, as easy as that. I'll duplicate this. I want button 1 to make the vertical arrangement visible to true when I click that button. And I will do the same with the second button, which contains the second question. I want the vertical arrangement number 2 to be visible when you click on that. So to avoid when the patient clicks on the first button, sometimes the 2 questions appear simultaneously. So I want to hide the second question. I just want the first piece of info to appear when the patient clicks on the first button. So how can I do that? I will just duplicate this one. I want when you click on the first question, the vertical arrangement number 1 to be true, but the vertical arrangement number 2, which contains the second info, to be false. Here I will do the same. When I click on the second question, I want the first piece of info to appear, but the second piece of info to appear, but the first piece, I want to hide it. So let's test that and see what we have done so far and is it correct or has any problems. So I want to click on the first button. As you can see, the first piece of info appeared, but the second did not appear. I want to do the same for this one. So the first one disappeared, but the second one appeared. So I just added 2 pieces of info for demonstration purposes. But of course, any mobile application should contain much more than that, because the educational section is a very important part of any application that is directed to patients. So we're almost done with the application. I want to add another page for disclaimer. So it's very, very simple. It's just you are going to add a text the same way we added a text previously. So here I'm going to type in disclaimer page and click on create. So it's up to you if you want this bar to be on the top of the screen showing that this is the disclaimer page, or if you want to hide it. For me, I want it to be here. I don't want to hide the name of the page. So the same way, I'm just going to add the space and make it something like maybe 5%. And then I will add a label that will contain my text. And of course, one of my team members already prepared the text for me. So I'm going to go here and just like copy that one. I don't want to copy this because I already have it. This one. Control C. So I'll go to the label 1 and put Control V here. And this is how I design my disclaimer page, as easy as that. So the last page, of course, it's going to be the author's page. I'll be adding the author's names here on this application. So as the same way, I'm going to put it on the center orientation. And I'll be adding like multiple labels according to the number of the team members that have participated. And I'll be adding the names. Yeah, this is like a very simple application to patients with congestive heart failure. So maybe one of the teams is interested in like adopting this idea and expanding on that and making it more like professional and add more features. So I'll get back to my PowerPoint presentation. So we have navigated through the app development platform. It's actually very entertaining and enjoyable. It might seem a little bit complicated at the beginning, but it's not that complicated. And I have included in the next slide some resources that I have used when I first started learning this, and they were very, very beneficial for me. So the first, I have included some YouTube channels and also app developer communities. So the YouTube channels that I have used, the first one is an Arabic YouTube channel. So for Arabic speaking fellows, you can use this. He's an Egyptian teacher. He's very, very excellent, and he describes everything in a very simple way. So I have learned a lot from his channel. And the second YouTube channel is an English channel. It's called The Coding Bus. So this is also very nice, and he is discussing multiple platforms like how to deal with Codular, the MIT App Inventor, and some of the more advanced app development platforms as well. So for the app developer communities, we have the Codular community and the App Inventor community. And when you enter the community itself, you can just like a Google search, you can type in your question, and most likely you will find the answer to your problem. Thank you very much. I hope I benefited everyone today, and please feel free to share any thoughts or any questions that you have. Thank you very much.
Thank you, Dr. Amal, for the extensive presentation on how to build an app and going through all the steps of building an app. We are very appreciative of what you have done for us. And I would like also to thank you for being an integral part of the blood pressure, the vaccination, the INR, and the newly released dental group app, plus the upcoming renal and the cancer screening app. I think she have explained it in a very extensive way. Just to add 2 or 3 points. One is when you start the group or being part of a group, always try to respect the deadlines, because it's just a combination of 8 to 10 people who finish the project. So try to be respectful on finishing your work at the allotted deadline, and ask if you don't know, because this is a learning process. Me personally, I started to learn by clicking stuff. So you can ask your team leader or your colleague or your group member the things that you don't know. And sometimes you can provide ideas and concepts that might seem not helpful to you, but that might give a good framework to the whole project. So again, I would like to appreciate you, and we are very thankful for you. And if you guys have question, you can ask her after Dr. Mafaz finished the presentation. Thank you.
Dr. Amal, I actually don't have a presentation because Dr. Amal has done a very well prepared presentation, and I would just like to add like a few points regarding mobile application development. It is a learning curve and it's very hard. However, the way Dr. Amal has presented it on Codular, on Glide app, they're all very easy. We have the support from our seniors, from Dr. Nader, Dr. Ahmed. There's also so many past seniors that have developed mobile applications, and also with Codular, there's an advantage where you'll be able to upload the application onto the Google App Store, which gives your patients or users all over the world the easy of access. In terms of Glide app developer, which is another application developer or another website developer, it's also very simple. It does not use the block system, but it's more of a you shift or you pull your desired feature onto the screen, and that's how it is developed rather than the block system. So it can be an easy beginner step for moving on to Codular, or if you're comfortable with Codular and you always have the support from Dr. Amal and other seniors, and as well as the YouTube channels and the community on Codular. So with Glide app, the advantage that I like about it is that there's no users that cannot have access to your application. So once you develop the application, once you launch it, you'll be able to have it being used by Windows users, so laptops, by Android and iOS. So everyone from any device users can always use your application. However, with Glide app, it will always be on the Google App Store. But however, currently I'm actually using both of them. So with Glide app, I can advertise the application towards iOS users or Windows. However, when developing and launching the Codular app, it's more towards the Google App Store. Therefore, the three softwares we're able to access their devices, and they're able to use the mobile application. But thank you very much, Dr. Amal. And it was very informative, and it's a learning process for all of us. Thank you very much.
Thank you very much, Dr. Nawood and Dr. Mafaz, for the great points. Yes, it's a learning curve, as Dr. Mafaz mentioned. It might seem like a little bit difficult at the beginning, but it gets easier and easier with practice. So practice is the key. And the YouTube channels that I have included will benefit you a lot. So please let me know if you have any questions. Thank you.
Thank you, Dr. Amal. I would like to show the new members all the app which was built previously for the last year and a half through the guidance of Dr. Amal and recently Dr. Mafaz and previously Dr. Nafisa. If Dr. Nadir can share the previously built app in the presentation, that'd be nice. If you have any questions regarding building an app to Dr. Amal or to Dr. Mafisa, you can ask the question.
Thank you so much, Dr. Amal, Mafaz, and Naud. This great presentation. Hopefully, it will help some of you guys. So I'm gonna just share the screen here, and so this is the apps that we developed so far. So we have different ones, one from the dental group and others. I didn't upload all of them, and so if you go there, it will link to you to the app. You can download the app on your device. All of them except this are in Google Play Store only. The dental care reminder app is also in the Google Play Store as well as Apple Store. So we are progressing very well so far. Thank you so much, everyone.
So if there is no question, we can proceed to the third presentation, which is going to be about approach to research using the NIS datasheet, and it will be presented by Dr. Walla Farah.
Yes, Assalamu alaikum. I'm here. Just make me a host because I cannot share my screen if you are hearing me, Dr. Naud.
Yes, I did. So please try it again.
So now you can see my screen.
Yes, we can see.
All right. So for today, I'm gonna talk about the mastering research with NIS database, approach to the research using NIS database. My name is Walla Farah. Thank you for Dr. Nadir and Dr. Naud for your support. I will just go for my agenda today with introduction to NIS database, dataset and research methodology, case study, steps to consume NIS, and challenging and solution. So through the introduction to NIS dataset, the national or the nationwide inpatient sample NIS is the largest publicly available or prior inpatient care database in the United States. So the nationwide inpatient sample NIS is the Healthcare Cost and Utilization Project, HCUP, is funded by the Agency for the Healthcare Research and Quality. Federal and state government, along with the industry, provide money to AHRQ, the nationwide inpatient sample NIS. It's one of the major database compiled or maintained by the HCUP. So there is some advantage and disadvantage of NIS dataset. But before to go to the advantage and disadvantage, we need to know what is NIS. So NIS, it's the large all-parent patient care database in the United States. NIS data are available from 24 years. If one want to examine treat over time, we need at least 20-year data. This database is adequate to examine the trend of any of phenomena of interest over time with reference hospital admission. So we'll go for the advantage. It's easy to accessibility of data, time saving, quality check, cost consuming, aid in policy making, ensure quality-based care, and easy quick start. The disadvantage is a threat to data security, over dependency on technology, special skills, and accidental loss of data. So we have a main characteristic of NIS. We are include the 7 million in the hospital per year, including 35 million stay per year. So that's mean the in-hospitalization or the patient admission per the year. So this is the data is going to be changed every year. Ideal for the developing national and regional estimated, there is an enable analysis of this data. There is a special population and common treatment and rare condition. So if we want to go for the deep analysis for NIS. So we have the table containing a big number of hospitality. So each table of these, we have 4 tables. So the first one is the patient stay, hospital, disease severity, and the diagnosis of the procedure. So these 4 tables contain a big number of hospitalities. Each table had a number of categories. So each of these tables had a variable yearly. It depends on the patient and the variety of the patient during the year. If we will go for the patient stay or the inpatient curve, we can see in the first table there is admission information, patient demographic and location information, payer information, diagnosis and procedure information, drug information, and there is the linked data element, hospital information, discharge information, and resource using information, and there is the way to calculate national estimate. So if we go for example on each of these admission information, that means admission day, admission per month, or admission into the hospital, there is any transfer from the other hospital, or there is indicator of emergency department service, or there is any admission type. If we will go for the patient demographic and location information, so that's mean age of the patient, sex of the patient, and race of the patient. So this is the whole of these. It's not including the name of the patient and anything personal related to the personal information. So if we will go for the other thing is diagnosis and the procedure information, it's going to be by details, and I put the link at the end of my slides. And for example, for the drug information, there is a diagnosis related group. And also there is under the hospital information, there is a location of the hospital and the hospital stratifier, hospital identifier, and so on. So the second thing is the second table for the hospital file that is related to the hospital, the discharge count, discharge weight, hospital identifier, discharge year, and hospital characteristic. So related the table 3 for the disease severity and measure file, there is the all patient refined drug, or there is the link data element. And the last table is table number 4 for diagnosis and procedure. Diagnosis and the treatment plan and the procedure for the whole patient. This is the clinical classification software refined, or the other thing is a procedure class is refined, or the and comorbidity measure refined, and the link data element. So after we collect all of these data and all of these table, so we will go, what we will need to do, we will go for that type of the research. I will put an examples for the different, or for at least the analysis we can do. So there is the descriptive analysis and comparative analysis, regression analysis, and predictive analysis. Each of these, it depends on these, the whole data we collected before, and we find it in the table since that the year we need it. So if we will go for descriptive analysis, that means there is a described behavior or scenario in the database, in the data set. Comparative analysis, it's a comparing two or more cases or the scenario. And the regression analysis, there is estimating the relationship between dependent variable and independent variable. And the predictive analysis, it's analyze the data to predict it for forecasting the future. So I just put an example for that, what we can do with previous information or previous data analysis. I put that in the some case study, there is analyzed trend in the hospital admission for the heart failure patient per state. I just put it an example. And I can say if we have an admission one person twice per year, that means we have 2 records in this year. But if the patient is admitted year by year, we can have a different type or different analysis per 2 years. So the second one is investigation is separatized in the surgical outcome among the different demographic group. So that means there is a different race, different age, and different sex. Wherever we need to focus on our studies, we can find it over there. So after we finish the theoretically of NIS database, we can go for the clinical research or clinical issues. There is the steps to consuming the NIS. So in the clinical, we need to check the computer. We need to download the running of the program, and we need to access to the NIS data. So as I put it in the diagram over there, there is analyst researcher. It's, for example, the follower, residence, student, whatever. And or there is another computer with this specification, and we have an application to access. The application, I put an example, is Tera, or maybe another. There is a lot of them. There is a different type of that. And at the end, we have the medical database, NIS. So the computer specification is going to be processed i10, 8 core, and 5 gigahertz. And the RAM should be 16 gigabytes or more. And the storage, the hard disk, is 128 gigabytes or more as well. We can use the Windows or Mac on other side of the Windows. So after we finish the computer, we need to go for the Stata. So for the Stata over there, there is a different version of the Stata. Every now and then they get a bit of modification. It depends on the capacity, and it depends of too many different of the variables. The Stata we have over there is Stata BE, Stata SE, and Stata MB. And this is all the different is going to or lead us to pricing the list. And there is a pricing the list for the student. Also, it depends on the time we need it for that. It's going to be 6 months, annual, or it's going to be forever, for the whole long life. So we can go at the end, we can go to get the data or to get the NIS. How we can do that? We can go to this website. I put it over there. If you are into this website, I just put it at the screenshot shortly to let you know. When you go inside the website, then they go to the browse the database catalog for the database availability and pricing. Then we can hit the database catalog. For example, I just put it at the screenshot over there, and we can find under the home page on the upper left of the screen, the browse the database catalog for the database availability and the pricing. And then we can go here for the product category. There is the nationwide, or you can put very state, wherever you put it under the arrow over there, and then you can select the start year, and the end year, whatever the years you want, and then we can go for the pricing at the end of this one. I put these, I'm so sorry. I put this a solution and challenge is if gonna facing sometimes if we need to getting the data or we need to data format. When we getting the data, you cannot directly download or reformat CSV file of the national inpatient sample, the data format, the healthcare cost and utilization, the project HCUB, which distribute the NIS provides the data in the fix with ASCII format. So compress and encrypt it. So the solution of this, we can go, because we cannot get the data easily. So that's why we can go for this solution. You can download the zipped data file from the HCUB central distribution website after registration and create an account. In this website, then the download the file we need it to be uncompressed and decrypted, and the using tool provided by HCUB at the end. I put the link of every single details and all of these cases if you want to go through all of these cases. And that's it. Thank you so much.
Thank you so much, Dr. Walla, on presenting a good approach of using the NIS datasheet for research purposes. If anyone have a question, you are more than welcome to ask. If there is no pending questions regarding usage of the NIS datasheet, we can proceed to the fourth part of today's presentation session, analyzing a paper or research paper by Dr. Ali Shata.
Hello, everyone. Good afternoon.
Good afternoon.
Thank you, Doctor. Thank you, Dr. Nader and Dr. Naoud, for always giving us the chance, and thanks to my previous presenters. I would like to present to you a session about how to critically analyze a research paper. Let me just share my screen. Can everyone see my screen?
You can see you, but you can't see the screen.
Okay,
You
I'm
are the
sorry,
host
just
now,
give me
so
a
you can share
second.
the files now.
Sorry?
We are only seeing the video, so you can share the screen and maybe turn off the video. That would be good.
Okay.
You can click share screen and then open your PowerPoint. There you go. Thank you.
Perfect. Hello, everyone. So my name is Ali. I'm presenting a session about how to critically analyze a research paper. In this session, we will learn the importance of critically analyzing a research paper. We will know what a research paper means and what are the key components of a research paper and the steps to analyze a research paper. The importance of critically analyzing a research paper. Why do we analyze a research paper? To ensure the validity and reliability of the research, to identify biases and limitations, and to help in making informed decisions based on research findings. How or where do we use these critical analysis in academic research? We use it in professional practice while we are looking for knowledge, and we use it also for personal knowledge growth. First of all, let's know what a research paper is. So a research paper is the primary form in which research results are disseminated in computer science. They can come in two forms, either in a conference papers, which are the shorter form of a research paper, or journal papers, which are the longer form of a conference paper. And sometimes they may come very years after the conference paper has been published. To understand the structure of a research paper, each research paper contains main structures. The first thing is the abstract, the introduction, methodology, results, discussion, conclusion, and references. The abstract is the summary of the study. In the introduction, we have the background of the current knowledge we have and the objectives of the research we are doing. The methodology is how the research was conducted. The results are the findings of the study. In the discussion, we put an interpretation of the results, and in the conclusion, we have summary and implications of the results of the study, and in the references are the sources cited in the paper. The first step in critically analyzing a research paper is evaluating the abstract and the introduction. As we said, the abstract is like the snapshot of the study. In evaluating the abstract, we need to evaluate the clarity and the relevance of the abstract to the knowledge we are seeking or to the information we are looking for in the current research. In the introduction, which identifies research question or hypothesis, we assess the rationale and the background context. We look for clear statement of objectives and compare those objectives to the objectives we are looking for in the research paper. The second step is analyzing the methodology. The key points of the methodology is that it contains a study design, which is the type of the study. We must look for a study design that's similar to the knowledge we are seeking and to the knowledge we are looking for. And for example, if we are looking for a causality relationship between two things, we must look for cohort or case control studies rather than just cross-sectional studies. We have the sample, which is the size of the study participants, the selection process, the demographics. We have the procedures, which detailed description of how the study was conducted. We have data collection, which are the tools and the techniques used to collect the data, and the analysis, which is the statistical methods employed in analyzing the data collected. Important questions to ask about ourselves about the study when analyzing the methodology is the study design appropriate for the research question? Are the sample size and selection methods adequate? Are the procedures replicable and transparent? Are the data collection methods valid and reliable? And are the statistical analyses appropriate for this study? The third step of analyzing the research paper is assessing the results. We look for the presentation of data, how the data are presented using tables, graphs, and charts. We look for the clarity and the organization of those data. On the analysis part, we look for are the results clearly stated? Do they address the research question? And are the statistical results significant and meaningful? Important questions to ask ourselves when we are analyzing the results: that are the data presented clearly and logically? Do the results support the hypothesis or answer the research question? Are there any discrepancies or unexpected findings between the results? And the fourth step is evaluating the discussion. The key element we must look for is interpretation of the results. Is there a comparison with previous research? Are there any implications for the theory, for practice, and for future research? And critical points to consider are the conclusions justified by the results? Are alternative explanations considered? Are the limitations acknowledged? Also, additional questions we must consider when we are analyzing the discussion is, do the authors provide a balanced interpretation of the results? How do findings fit within the broader field? Are the implications for the future research clearly stated within the discussion? The fifth step is reviewing the conclusion. In the conclusion, we have a summary, we have implications, the implications of the study. In the summary, which is a brief recap of the findings, we must look for if they are significant or not significant. In the implications of the conclusion, we must look for, are they practically applicable? Are there any recommendations for future research? Critical points we must take care of are the conclusions consistent with the results? Are the recommendations practical and relevant? Okay. And the sixth step is checking references and citations. We must evaluate the quality and relevance of resources cited, the citation of recent and seminal works, and critical points we must pay attention to are the references comprehensive and relevant. Are there any significant omissions? There are some few tips we must use when critically analyzing a research paper. The first thing is to read the research paper multiple times with different focuses. Each time, the first time, for example, we focus on the abstract. The second time we read the study, we just focus on the methodology, and so on. The second tip is to take notes and summarize the key points of the research paper. We can discuss the paper with peers and with different perspectives, so we can fully analyze the paper. One of the best ways to critically analyze paper is using checklists. For example, using the CASP and PRISMA. Both of them are checklists used for critically analyzing research papers. Also, we can use academic writing guides that can help us. Some common pitfalls to avoid while critically analyzing a research paper is overlooking the methodology, ignoring potential biases, accepting findings at face value without scrutiny, not considering the broader context of the research. This is the end of my presentation. Thank you, everyone. And if anyone has a question, I would be happy to answer that.
Thank you, Dr. Ali, for the nice and precise and to the point presentation. For those of you who have no history of publication or who are in the early stage of trying to make a publication this year, Dr. Ali's presentation is just the framework of how you should start, what kind of data you search, and what kind of consideration you should take before you even try to start a systematic review or case report or cross-sectional study. So for starters, this is the basic framework of proceeding with a research paper. And if you have any questions, you are more than welcome to ask.
Thank you for great presentation, both Dr. Ali and Dr. Walla. Walla, thank you so much, both of you. And we can move on to the next topic.
Okay. The last part of today's session is a discussion about organizational skills by Dr. Roaa. If she is available, she can proceed.
Hello, is my voice clear?
Yes.
Hello, everyone. My name is Roaa Suliman. Thank you, Dr. Nader and Dr. Naud, for the opportunity. Today I'm presenting, inshallah, the organization skills. But I have problem opening the 1 minute. Can you see my screen now?
Not yet.
Hello? Can you see my screen, doctor?
Not yet.
No.
Oh, okay, 1 minute.
Since you are the host now, all you have to do is click the PowerPoint and you will have an access to the.
Is it good now?
Yes.
Okay.
Thank you.
Thank you so much. Okay. Today I'm presenting organization skills, what they are and why we need them. Okay, first we begin with the objective, how to improve your organization skills and get things done. Then we go into structure your time better and effectively delegate tasks to others. And how to use simple tools in order to improve your decision making and problem solving. Okay, so before we dive into the content, there is a question, important question to think about, which is what is one thing you could do that if you did on regular basis would make a tremendous positive difference in your personal life and workplace? Okay, so we go to what are the organization skills? First, organization skills are tools we can use to stay focused and efficiently prioritize our personal responsibilities. Okay, practicing organization in day-to-day activities can help us manage our workload and equip us with the tools and strategies needed to thrive in any role. Okay, organization skills also include processes to keep our work structured and measurable. What are those organization skills? First and most important is time management, which is like the ability to plan your time effectively and make the most of our day. Second, it's collaboration. It's the ability to work effectively with others to achieve a common goal. Delegation is the ability to assign tasks to others and trust them to complete them. Then communication, which is the ability to clearly and concisely communicate your ideas to others. And the last is goal setting, which is the ability to set a SMART goal, which is like should be specific, measurable, achievable, relevant, and time bound to develop our plan and achieve them. Okay, in time management, we need to make a schedule, create an appointment, and planning in advance. Okay. In collaboration, there is working in groups or teams, learning different perspectives, and building trust and rapport. When we collaborate effectively with others, we can achieve our goal precisely and learn from each other and get different perspective on a project. And delegation is an important skills for anyone who has a lot of responsibilities. When you delegate tasks to others, you can free up your time. And also to keep like important things Delegation can also help us build trust and rapport with our colleague. We need to ask for help, build trust, and focus on strength. After delegation, we have communication, which is an essential for any successful organization. When we communicate effectively, we can ensure that everyone is on the same page and that projects are completed on time. In communications, like communicating ideas, the feelings, needs, and expectations, creating a healthy work environment, and removing uncertainty. The last is goal setting. It's an important organization also to help us achieve our goals. When we set a goal, we need more likely to achieve them. There are a number of goal settings techniques, such as a SMART goal method, which is like we have specific, measurable, achievable, relevant, and time-bound. Okay. After we finish what are the organization skills, now we go to why. Why are they important? To save time, energy, reduce stress, and improve quality of work. First, that it can help us save time and energy when we are organized. We can find what we need quickly and easily, and we are also less likely to waste time on tasks that could be avoided. Organization skills can help us reduce stress. When we are organized, we are less likely to feel overwhelmed by our workload. Finally, it can help us improve the quality of our work when we are organized and more likely to produce high quality work that is on time and budget. Okay. Here have how to showcase organization skills on our resume. There is like we need to list our skills on the resume, use keyword, and quantify our accomplishment. We also okay. We also need to have the ability to plan effectively. That's what we should include in our organization skills in our resume. That we have like goal settings, ability to meet deadlines, multitasking, problem identification and resolutions, being adept at following instructions, the ability to manage a meeting, maintaining an orderly work environment, the ability to delegate assignment. That's what we need in our resume as an organization skills. Okay. 1 minute, sorry. There are few steps on how to improve our organization skills at the workplace. First, we need to create a clean workspace, and then identify goals to meet and build a to-do list with the team, and to complete each task and meet the deadline. Then prioritize each task and input task into a schedule. Organize our materials and make the most of our time, and maintain healthy work-life balance. Okay, and in conclusion, we also have organization skills are essential for success in any field. Developing our organization skills can improve our time management, communication, and goal setting abilities. There are a number of resources I will put down there. Those are the links from Coursera, Skillshare, and Lifehack. And that's it for today. If there is any questions, please.
Thank you, Dr. Roaa, for the nice and precise presentation on organizational skills. In fact, nowadays, when you apply for a job, or even if recruiters are trying to consider you as a candidate, and even for residency, organization skill, communication, conflict solving and leadership are the four most sought qualities for any recruiter or any person who is going to hire you. So this is a good presentation on how to be a good candidate and how to be an expert in organizing different tasks while being as a doctor or while being allotted other kind of jobs. This organization skill also goes hand in hand with communication, leadership, at the same time also conflict solving. So thank you very much, Dr. Roaa. If any one of you have any questions, you are more than welcome to ask.
Thank you, Dr. Nader.
Thank you so much. This great presentation as well. Excellent. Good job.
Thank you. Thank you so much.
If any of you don't have any questions, we will go to the last section of our presentation, which is update on different projects or anyone who's an idea on starting a new project. The floor is yours.
Any
So
question?
I can provide update of Forest Screen 1 team.
Yes.
Hello, Dr. Nadir and everyone. So my team and I are writing a systematic review on the efficacy of left ventricular assist device in heart failure with preserved ejection fraction patients in comparison with medical treatment. So we have already selected articles from SearchString for the systematic review, and we have divided group among the subheadings among each other, and hopefully we will complete writing it by next week and let you know.
Sounds good. Excellent. Good job.
Thank you.
Thanks for sharing. Any other updates? Any questions, comments, suggestions? So I just want to update you. We are still working on getting this program up and running and increasing in size. So we are trying to get a new umbrella for this program that can support us and go forward. So I'm gonna keep you posted as far as the next step. We will try to get some funding in the future, hopefully in the near future. So I'd like to thank you all for sticking and learning and teaching us all. If no more questions, I'd like to thank Dr. Maud and his team. Thank you all for great presentations and demonstration, tutorial. Thank you, and I hope this meeting will help some of you, if not all of you. And thank you for attending. And for those who will watch the video later or the recording, thank you. Dr. Maud.
Thank you, everyone, for attending this meeting. And I would like also to thank the presenters today, Dr. Mistre, Dr. Amal, Dr. Mafaza, and Dr. Walla, as well as Dr. Shata and Dr. Roaa. And I would like to also thank the people who raised very important questions and comments. So have a great night or have a good afternoon, depending on where you are. Thank you.
Thank you so much. Dr. Ahmed, are you still there? If you have any last comment before we adjourn.
Hello, Nadir.
Hello. Go ahead, Dr. Ahmed.
Yes, I have not much to add, but I'm sorry I got disconnected for reason or another. I'm not sure if that happened to you or not.
Yeah, for me also. So that's okay.
Yeah. So thank you. Thank you for the presenters. And the last presenter talks about the skills, and I think by way on another, we need to manage stress in this ever-changing world. I would like just to mention one thing, like nowadays, and as we talked in our previous meeting, that medical knowledge is renewing itself very frequently. Like it used to be 10 years, but right now, even the medical knowledge is doubled in a matter of months. This sheer amount of information, we need to handle it. So look, if you are a medical student or you are practitioner, fellow, consultant, there is a lot of information in your respective field. The thing is how you deal with this amount of a large knowledge in addition to the patient care, in addition to you might have other responsibility, teaching, and also your family. So the most important thing is you have to define and your role just to yourself. And the other thing is try to prioritize your things. Try to have a written schedule that will help a lot. Okay. We are not immune from stress, from anxiety, from mood disorders. So if you have anything that needs to be addressed or help, don't hesitate. For example, in our institution, every now and then, physician, nurses, and all the team will get emails if they need any kind of counseling, any help. Are they getting overwhelmed? And also, there is a module that is you have to do every month, and that is specifically target the work burden, stress, and even it will ask a specific question about how many hours you sleep. Inshallah, I will coordinate with Nadir and with all of you that we need to have a module targeting all these things in collaboration with the presenter, like a great job and a great effort has been paid on this presentation. So thank you so much. And it is a great chance that we have to think about this, because the health is both the health of body and mind. We take it together. And also in this fellowship, of course, most of you are young, and so don't forget to exercise, any type of exercise, and that will keep our body and mind sound. And good luck. Thank you.
Thank you so much for sharing with Ahmed, and it's a great idea. So we'll be working on that in the future. Again, thank you everyone for attending this meeting. Thank you for the great presentations, and thank you, Dr. Nawad, for moderating this Zoom meeting. And we are looking forward to seeing you next week. Assalamu alaikum. See you next week. Salam.
Thank you so much, Dr. Nadir. Just wanted to come online and say thank you again for everything you have been doing for us. I know many of us got matched by the grace of Allah first, then your effort. Thank you so much.
Really appreciate it. Thank you so much.
Thank you. Thank you so much. Thank you. Jazakallah khair. Assalamu alaikum.
Good luck.